Great. And what I'm going to do, guys, I'm going to go ahead and start. What I want to do is actually go ahead and I'll temporarily mute everybody. If you have comments, please feel free to chat them in or unmute yourself at any point. Happy to chat about all of this. I want to take an opportunity here to share a little bit of a deeper dive on how to potentially use the cardiopulmonary and acute care content that PhysioU has to augment your classroom. Let me actually go to the next slide here. Just so you know, a number of professors have emailed in and asked me to record this, so I'm recording this so that other faculty who are stuck in meetings, comps, we're having a comps discussion right now with our students. People who couldn't come join this meeting, this will be recorded, and I will post this to you as well as onto our website. So just briefly, who am I? I'm an associate professor at Azusa Pacific University. I've been here 17 years. I've been an entry-level DPT, teaching orthopedics primarily. At the university, I fill the role of a teaching and learning fellow. So I've had a chance to think a lot about what are the challenges of turning our students into clinicians. It's not just about information delivery. There's so much more as we prepare them for the clinic. And my specialty training is primarily in orthopedics. I did a residency, a manual therapy fellowship. I currently teach for the Kaiser Permanente residencies and fellowships, as well as the USC Spine Fellowship, where we use these apps as a way to develop big picture research implementation, guideline implementation. At the university, I also chair the IRB, and actually one of my deep passions that I'm so excited to share with you is building apps to improve education and improve learning for students. That is PhysioU. So I thought it would be pertinent to mention that Dr. Ellen Hillegass and I have been talking a lot about how do we support educators in this moment. And so we are partnering together to be able to provide videos for all the lab techniques you would need for all of your cardiopulmonary content. And she also has online courses that, in the case where, for example, for many starting programs, you have a need for a cardiopulmonary curriculum, PhysioU and cardiopulmonary educators together has a everything in a box that you would need for a cardiopulmonary class. I thought it would be good to just see a note that Ellen sent to me. She wrote, "As president and CEO of PT Cardiopulmonary Educators, I'm thrilled to be partnering with PhysioU and Michael Wong to provide the best resources for teaching cardiopulmonary education, including labs and case studies. And I will show you glimpses of all of this and how it can help in your classroom." She also noted that when the institution where I am an instructor, Mercer University in Atlanta, went virtually for education due to COVID-19, we turned to PhysioU labs and case studies to help our students who could not have hands-on lab. This content is also great for new instructors who are not familiar with providing lab opportunities in an academic institution. So both her and I have been thinking a lot. How do we support the educators? How do we support the students? How are we going to teach lab online? I mean, our cardiopulm class starts in fall, and we're not even sure if fall is going to happen. Give me 1 second. I'm going to stop my video to minimize. James, you guys can still see me and hear me?
Yes, I can now, yes.
Okay, great.
There's one short time and a half ago you ducked out for about 5-7 seconds.
Okay.
Now you're back. Good.
Yeah, perfect. So I'm going to move on here. I'm going to share a little bit. So Dr. Shore and Dr. Shore is the Cardiopulm app author, and she's the chair of my department. And so we thought a lot about what were the challenges in her class and potentially how we could improve that. So I'm going to share a little video that we made asking her some of these key questions.
I've taught cardiopulmonary content for almost 20 years. Challenges teaching about cardiopulmonary patients tend to be you don't have those patients with you as you teach. These are patients that are fragile, that go off quickly. You don't have examples of the person in front of you many times, particularly the acute patients. So the idea with the app was to create examples of patients that you could see and watch the performance of techniques, as well as integrate with an understanding of diagnoses, how patients present, how to examine them, and how then to treat them. I think this will make things very clear and cohesive in students' minds. A particular category of patients, how they present, examples of the findings for each of those. I think it will make it much clearer for students to learn the material. Instructors will find this a useful tool, I believe. In the classroom, you can teach pathology, pathophysiology of disease, but to explain what a patient looks like, it makes it much clearer to be able to show a video saying, here's a patient, and here's how they will present. Based on that presentation, here is what you as physical therapists will find upon your examination. Based on your examination findings, this is how you would proceed with your intervention. It makes it much clearer to students to understand the application of the pathophysiology that you've just discussed. I believe students will use this on their own to continue their learning. You can discuss things in class, but they will have at their disposal any time of the day or night a recording where they can look and see how the patient presented with findings and what we did about that. It's available to them at the touch of a finger.
So Dr. Shore and I spent a lot of time actually thinking about what were some of the challenges that the students were having when it came to cardiopulmonary rehab class. And a lot of what we discussed was that there was no context. There wasn't a big picture of what these patients look like. Very few students have had a chance to see cardiopulmonary rehab in its entirety. I'm not hearing the audio. Is anyone... sorry about that. Can you guys hear me now, James?
Yeah, we heard you the whole time.
Oh, okay, got it. So it sounds like a few people were having a few problems. So here are 4 ways to use the cardiopulmonary app in your classroom. So I thought what I would do is give you a quick glimpse into the app itself. One of the key concepts that Susan and I talked about was, could we draw a picture from the patient, their story, their signs and symptoms, and eventually link that to the objective exam, and then link that to the interventions, connect all the dots. So what I'm going to show you here is I'm going to take you to the app, actually. Let me move back a second here. I'm going to take you back to the app. So here, for all of you faculty, you all have full faculty access. So when you log in at PhysioU.com and you sign in, when you sign in here, you will see that the cardiopulmonary app is here. So you can choose the most common diagnoses. And these patterns are all matched, meaning when a student goes in, Susan, what she would do is she would have her pathophysiology lectures online. And after those lectures, the students would watch these together in class with her. So this would be in your online synchronous sessions.
Well, I have been fairly active all my life, but lately I have been so tired and so weak. And what frightens me most is my legs and my feet have been swelling. And I'm having a little trouble breathing too. I need 3 pillows to sleep at night. I've had high blood pressure for a long time, and my doctor has given me medication for that, but sometimes I forget to take it, in fact, often.
So then they would have a discussion about the signs and symptoms that the patient is complaining about and how that ties into the PathoPhys online lectures that they had watched. We would then talk a little bit about the common outcome measures, some functional performance measures. These are all tests that you can watch and you can learn about. And there would be a subjective exam performed by a cardiopulmonary specialist. This is a generic subjective exam that the students could watch and learn from. Here are the components of that exam. And you can then go in and talk about the objective exam, the physical exam for this condition. There's a little key findings video that helps to describe the main findings of this condition.
Cardiac muscle dysfunction associated with congestive heart failure and cardiomyopathy. On exam, you will find peripheral edema of the lower extremities. On lung auscultation, you will hear normal breath sounds with fine or coarse crackles in the lungs. Listening to the heart, you may hear an S3 or an S4 sound. There will be decreased aerobic capacity and decreased functional strength.
So this gives the students a big picture of kind of what is common and distinct about this pattern. There is a chart review available, so getting the students used to doing a chart review, especially in an electronic medical records environment. And then your objective tests. So many of these objective tests are common things that you would do among the different conditions, yet some of them are very specific to this particular condition. So the students, as they are learning the details of all the different little skill sets, you're able to talk them through the common and different parts of the exam that help to differentially basically define each condition. The other important part, I think, is being able to connect the physical exam, the patient's presentation, the impairments that you ended up finding on your exam, and then tying that to the interventions. So you can see tying that to the interventions here. So all of these common interventions that they're going to learn in lab, they can preview on their own, and they can see them in the context of the big picture. So you can see even for the progressive therapeutic exercises, there are signs and symptoms for stopping exercise. So some contraindications, some signs and symptoms, some abnormal ECGs that you might be watching out for. So that gives you a picture. Now you can imagine all of that is available for each of the common 5 patterns. Okay, so each of the students will eventually go through and play through each of these and discover all the connections that are unique to each pattern, and also discover things that are common among the patterns, especially in the examination. So that's a glimpse of what I mean by scaffolding. That's a glimpse of what I mean about scaffolding, creating the big picture, allowing the students to sort out all the details in the context of the common patient presentation. The next thing I wanted to share with you was about how you can help with motor skill training. So it's unpredictable. We are dealing with the same thing. How are we going to teach? How are we going to teach some of these motor skills in the context of not being able to be face-to-face with them? Well, what we've been doing at APU and what I envision doing for my orthopedic class come fall is that the students should be able to preview all the lab techniques that you're going to be showing them. They should watch it ahead of time. Then they should try some of them out if it's possible, because there's a lot of things that they're going to learn and a lot of questions that they're going to develop by trying them out. When you get online, Let me double check here. Anna, all of these are simulated patients because it would be very difficult to bring in real patients. Some of them do have some of the heart surgeries, things like that. Guys, I apologize. I think the internet is breaking a little bit, but yes, I will slow down a little bit. I think everybody's having a little bit of internet issues, so sorry about that. But this recording will be available. So imagine the students learning the techniques ahead of time. Then when they come online with you for the synchronous sessions, you are able to now watch the techniques together and give them extra nuances about how you would like the techniques done a little bit different, or how or what context in which to use the techniques. The last thing that we've been doing at APU is the students do a virtual checkoff. So every week they will sign up for a 15-minute slot, and the TAs, which are usually our third years, will will tell them, here are some techniques I need you to try to show me. And then they'll give the students a little bit of basic feedback. That has really helped the students feel like there's still this one-on-one connection as the motor skills are being developed. And we found, actually, we just had our range of motion manual muscle test palpation final. The students did quite well, actually, and half the class was done online using the PhysioU apps to show the techniques. So this is what I wanted to show you about how simple it would be to augment all of your lab handouts with PhysioU videos. Probably every technique and intervention you need for your cardiopulmonary class, we have filmed, and it is free for you to utilize. So you can see this particular lab here. So I'm going to show you how we do that. Turning your cardiopulmonary rehabilitation lab manual into a fully fledged multimedia learning tool is as simple as accessing the PhysioU master video list and adding these videos and images into your labs. So a simple lab that could look just like this. If you go into the Cardiopulmonary app, you'll see that all these physical exam and intervention techniques are all here.
To assess your patient's equibrachial index, you will first start off by measuring the systolic blood pressure in both arms.
These videos can all be found in the Educator free resources. Here in the PhysioU Master Cheat Sheet, you'll see all the videos that you need. So we're going to switch over down here to the appropriate app, the Cardiopulm app, and I now need to find some techniques to add to my lab handout. So I'm going to do a search, and I'm going to look at ankle brachial index. There it is. Under physical exam, all of my techniques here. I will just cut, copy, and add that right into my lab handout. I usually then go right into the technique, take a screenshot of the technique, and you can also add all this content into your lab if you need to. Maybe some image here.
Still blocking out a little bit, Mikey. Dr. Wong. Sound-wise.
That's okay, as long as you can kind of see what's going on.
You can augment your lab handout. So if we look at heart auscultation.
So,
turning your cardiopulmonary rehabilitation.
So what I was going to show you here is for your lab handouts, if you go to PhysioU.com, under Educator, there's some free resources. In the free resources, you will see this PhysioU Master Cheat Sheet right here. When you click on that, you will see all the videos of every app that we've created, all here available for you to utilize for your online labs. So you can see all the professors here adding this content into their labs, into their lectures, into their LMS. So if I switch to Cardiopulm, I can now type in ankle brachial index. Here's ankle brachial index, or blood pressure, calf girth measurement, and I can just copy and paste that directly into my lab. So the students will be able to now click directly into the video and preview the techniques that you're going to teach them. And in your online lab, so to speak, your synchronous session, you can actually open your lab, click on the links, watch the videos that you want to see, and talk about how you want them to try these techniques out. So that's how simple it can be to utilize all of this content. Let me take a moment, James, to take a couple of questions. I know some people are having problems hearing. Do students have to purchase an account in order to view the videos? So no, for the students between now and August 15, PhysioU is offering all of PhysioU for all students and faculty in the world for free, because we knew that everybody is struggling and trying to figure out how are we going to do this online teaching thing. And so I will talk a little bit about that towards the end. But yes, all of you have access, Lori, to this master list of videos. Again, it is on our website under Educator Free Resources. And on the right-hand side, there is a big PhysioU Master Cheat Sheet. So all of these links, yes, you can put into your LMS as well. As long as the students log in once, they will be able to watch all of these videos whenever they want. And you as faculty have full faculty access, meaning you can utilize this as a reference tool whenever you like. Believe me, all of us who have built these apps are professors who just yearn to do a better job for our students. And so we've provided this for all faculty for free, forever. But for the students, we do ask that, well, put it this way, throughout the summer months, while all of us are stuck in online, all of this is there's no cost, there's no commitment. It's just for you guys to utilize and just see if this is something that you would find useful. I would also say that we have done many iterations of this. As faculty speak in, as Ellen speaks in, as different faculty have contributed to help make case studies, we've continued to evolve this, which is why we've created this as a subscription model. We're constantly updating it and making it better. And I'll show you a little bit more about that as we go. So that's how you can actually add labs, add videos to all of your labs. This is exactly what we're doing with some of the schools that don't have a chance to film all of this now, to film it, to edit it, to organize it. This is another cool thing that we are using that I think you will find very useful. The tool is only as useful as the students are invited into it. So what we've created are clinical pattern recognition worksheets for each of the 5 conditions. So, and all the worksheets are interactive. So you could deploy this to your students immediately, have them work their own way through the different apps and work through the worksheet. So I'm going to show you what I mean by that. Again, on the free resources, you see these cardiopulmonary pattern recognition worksheets. So if you click on that, it will take you to a Google Drive link that has a bunch of worksheets for each of the common conditions. So I'm going to click on one of them. Let's see here. Okay, so what I want you to see, in fact, it will be, let's see, do these links click? Yes, okay. So, restrictive lung disease. The students will go in and look at what is the diagnosis that is typical with this condition. So they will fill this in. Then they'll go in and look at the clinical practice pattern. So they can click on the link. The link will take them directly into the app. Here's restrictive lung disease. Here she is about to tell her story. Here are the common associated diagnoses and the clinical practice pattern. From there, we can go back to the sheet. View the clinical findings video. So when you click on that, they are going to go ahead and watch this person telling her story.
I'm so tired all the time, and I just have a hard time breathing.
So once they do that, they are kind of talking about what do they notice about the signs and symptoms. How does this relate to the pathophysiology? What kind of function do you suspect the patient will have trouble with? Then we ask the students, hey, can you take a look at the common outcome measures that are relevant to the patient? So you click on that and it takes you directly to the relevant outcome measures. We also ask them to look at some common functional performance measures that might be relevant. Then we ask them to explore. Okay, before you come to class where I'm going to teach you all these techniques, I want to set the stage for you. So I want you to go into the physical exam and view the key findings video, which is what we viewed earlier. So that would be this video here, the key findings video, because it contextualizes all the things that they're going to do in the objective exam. So again, the students are kind of going through and exploring, playing with the videos, getting these patterns set up as a scaffold to now hang the details on. And then here are your interventions. Preview the techniques and activities commonly used for rehab of this condition. They click on the link and it takes them directly into the interventions. My whole goal with creating these worksheets is because it helps the student to now take learning into their own hands and to develop the connections of these common patterns. Because then when they come into the sync sessions, the online sessions with you, you can walk through the app and also talk about how all of this comes together, right? So it becomes a platform for you to be able to share your thinking. The things that you speak about, they can actually visually see. Techniques that you want to demonstrate in that moment, you have videos to demonstrate it. So that is, you can see that there is a worksheet specific for each of these conditions. Peripheral arterial disease, obstructive lung disease, cardiac muscle dysfunction, you have all of them here. Each of them the students can do once a week, learning these different patterns, playing through the app themselves. James, any questions about that so far?
So, not that I've seen so far.
Okay.
Yeah,
Okay.
just have some other at-large comments, but I'll hold them till the end.
Okay, so those clinical pattern recognition worksheets, again, are in PhysioU.com. Under Educator, you have those free resources, faculty resources, and there is a folder there for these worksheets. These worksheets are all... What's that?
One thing a couple questions, and it's a common question throughout the webinars that I've been on with you, is where to find those faculty resources. So maybe a suggestion is some of the folks have indicated in the chat that they went and looked at and found the faculty resources. So maybe all the rest of you folks online can make sure you can access it and know where it's at before we end the call today, so that way we can make sure you know where to go get them.
Right. So under PhysioU.com, here under Educator, are some free resources. And you will find... Yep.
Oh, keep going, Michael. Then you'll find
these worksheets here, as well as that master cheat sheet here for all the videos. And just remember that when you're in the master cheat sheet, you have access to every single app we've created, every neuro exam technique, every cardiopulm exam, cardiopulm video, every transfers and assistive devices, gait training, bed mobility, all of it is here for you to already leverage into your classroom. It just really depends on what content you're teaching and then how you want to leverage this content to help with the motor skill development. Go ahead, James.
The other one is the comment about the standardization of the patients or whatever. And I think that I remember in the past, people you'd have work experience. You get credit for your application to get into PT school if you had some work experience. And I think that's harder and harder to get now at all, if at all, because of HIPAA and other things. So this is ideal for the students who have very little cardiopulmonary background. They can kind of see the questions and the type of patients. I fell in love with PhysioU with the Gait app when I would go online, find a nice Gait video, and then go back, teach a class the following year, and that video's gone.
Right.
And so here you got standardization of it. And so you can actually, now know what you'll have resource-wise to teach with as you go. And I know you're always updating it, Dr. Wong, and you let people know when you do.
Right.
And but that's a beauty of this, is that as an instructor, you have very concrete resources to tap into.
I do know one of these patients for sure had a chest surgery. I think he had heart surgery. All of these, in order to have the patient tell the story, the picture of what we wanted to show, we purposely created these vignettes so that the pattern would be very clear. Because I think in the beginning of learning, it's helpful to have these very defined patient types. And eventually, as they go out into the clinic, they will see that there is a variation of gray. But in the beginning of learning, it's okay to be very defined. It basically helps them create some type of clarity when we are trying to help them see the connection between impairments and interventions and the patient kind of signs and symptoms, and being able to connect that to the pathophysiology. I think this is where we've been very focused. How do we help them take the next big step, which is no cardiopulmonary experience, to now knowing the 5 common cardiopulmonary conditions, how they are different, how the pathophys drives their signs and symptoms, how we manage those impairments. I think that connection was really why we could have easily just filmed a bunch of videos and thrown it on there and said, everybody, you have lab videos. But in fact, the problem we were trying to solve was, how do you create clinical patterns that students can recognize, that clinicians can recognize?
Michael, the other one was a quick question on lines and tubes. And I think I answered that there's a standalone app for that. So, because that's obviously related very much with cardiopulmonary.
Yeah. I put in a small section for that right at the end.
Okay, good.
So I'll go over that.
All right, thanks.
So here's the call to action. Students should take responsibility for their own learning, because honestly, as a faculty member trying to go on Zoom every day, I'm exhausted. So I'm going to give them a call to action. Every week, you're going to do a clinical pattern recognition development worksheet. You're going to run through one condition all the way through, because it's going to show you the techniques, it's going to connect the dots for you, and it's going to make our online synchronous sessions that much more rich. So I consider this as graded exposure to the patterns, so the students can familiarize themselves with the content that's going to be discussed that week. One other key thing that I think would be very useful. In my orthopedic class, I play the app out every week. I use the app as a form of repetition to help them see things again, to help them reconnect to the patient's presentation, to pull out an intervention that I want to highlight. I use the app every week over and over again, because this visual representation of your clinical reasoning is powerful for them to mimic. It's powerful for them to see as they are trying to sort out all of these details. And especially in the environment where you don't really have the option right now to do fake patients, to have case studies that are easy to do like we would do in the classroom. The last thing that I want to mention is how we've spent a lot of time developing case studies. So we've created so here we are in the app, the Cardiopulmonary app, and at the bottom of the quick access panel. So in the quick access panel, you have physical exam, interventions, all the techniques you need are here. You don't have to play through the patterns. You can access it right here. This is what we use for our labs. in the case studies, we have the 5 most common cases, and I'm going to take you through one of them. So here's our lady with the swollen ankles, swollen legs, complaining of fatigue, and we've created her case here. So the way you can use this is in your Zoom breakout rooms, the students will watch the video, they will read the case together. So history of present illness. She needs 3 pillows at night in order to fall asleep. Her chief complaint, right? Acute dyspnea, shortness of breath, some past medical history, some aggravating factors, functional things that she can't do, and her basic chart review. Some of her basic physical examination findings. And the students are instructed in your Zoom breakout rooms together, please go over each of these questions, because when we come back together, we are going to have a discussion. So what findings are consistent with diagnosis of CHF? Now the answers are all here, but we tell the students do not look at the answers because we're trying to help you develop your clinical reasoning. So here are your common symptoms. These are also linked into the app under the clinical findings. So we go back into the case here. We also have things like, what are some modifiable and non-modifiable risk factors? You decide to auscultate the lungs and you hear the following sound. So then the students will go back and they have to make some decisions, right? What is it? Why might it be present given the patient's condition? Here you're about to have the patient begin to exercise. You're in the critical care unit. Here is the patient's ECG. What is your interpretation? Should you proceed with the exercise? And as they progress in their exercise, so I'm going to go back down to the bottom, you note during exercise that the rhythm has changed. What would you like to do now? What do you see? So you can see that we have tried our best to create simple cases related to each category and allow the faculty and students to now engage in ways to develop their reasoning and tie a lot of these pieces together. So we have cases for each of the common conditions. Any questions about that, James?
No, just how they would download some of the stuff to their courses and their learning management systems.
Well, I think what you would do is essentially, for any of these cases, if you wanted to, you could go straight to the case and you can grab the URL and place that URL wherever you want. Because when the students click on that URL, it's going to take them to the appropriate case. I would also say that, Andrew, we taught in one of the multiple systems classes, we purposely made some of these cases. For example, this patient's having a lot of pain as he's ambulating. Well, he happens to be also at the age where he may be having stiffness in his spine and degenerative spine disease or spinal stenosis. So we used this opportunity, right? So here are some ags and eases. I can't walk for more than 10 minutes. Well, that could be a cardiopulmonary problem. That could be a musculoskeletal problem. Here's his ABI. Here are some of the findings, including some straight leg raise findings. And so we also asked them to consider what are some potential orthopedic tests that might be relevant. And of course, these are also linked within our apps because students can now reconnect to things that they are seeing. All of this is interconnected. So we had a great discussion about the case in which the patient may have cardiopulmonary issues, peripheral vascular issues, but may also have musculoskeletal issues. How would you tease that out? How would you drive your intervention? What decisions would you make for your intervention? So these cases, we carefully thought through several of them and tried as best as possible to make the reasoning even more complex, so that students could really see in real life how so many comorbidities exist in our patients. The last couple things that I want to show you, let me go back to here, is the Lines and Tubes app. We recently did a big update on the Lines and Tubes app. So another professor had made some great comments, directed us to a great, I think it's Dartmouth College, had a great resource that we kind of reviewed, double-checked what we had, added things that we thought we would need to beef up the Lines and Tubes. So I'm going to take you into the Lines and Tubes app real quick, just to show you why we did it. The students said, man, when we come into the acute care class, it's kind of daunting to see all these lines and tubes. So I wonder if we could go in, take images of all the common lines and tubes, talk about the purpose, the placement, the indications, and the clinical implications, things that we want to be careful about. So all of the lines and tubes sorted by body region. So you can see sorted by body region. And we also started releasing case studies so that the students could go in, read a brief history, and start to identify things that they are seeing and think a little bit about some contraindications. How would you ambulate or perform physical therapy with this patient? What should you do if you pull out the drain accidentally? So we have 5 other cases that we're working on. It's just right now it's hard to get back into our classroom to be able to film and take pictures. So we'll continue to release updates of these different cases. So again, you can see that we are trying not only to provide reference material, but also make it easy for you as faculty to just utilize these case studies to develop their reasoning and to have a platform for discussion. So that's the Lines and Tubes app. Of course, in your course, a lot of the acute care courses have some form of transfers that might be a part. This is our Assistive Devices and Transfers app. So all your common transfers are here for right lower extremity, left lower extremity, both lower extremities. You have all the bed mobility that you would probably teach, all the basic bed mobility. You have all the assisted devices, the fitting, the gait patterns. Of course, for left and right lower extremity. So we filmed it for both because our students, not only do they learn to do the gait patterns with the videos, but they also use this as a way to train patients. So they'll watch the video together with the patients. Then they will send the video home to the patients so that they can remember how to walk properly. So boom, you have a video sent to your patients. As well as, I would say, getting up and down stairs with your crutches, right extremity, non-weight bearing. All of this now becomes part of your entire acute care cluster of apps that you could utilize. And the thing is, all of this is in one place. You can jump to whatever you want. So notice when I click on the app, here is our cardiopulmonary app right here. Here is our Lines and Tubes app. Here is our Assisted Devices app. All of this is available for you, and you can grab videos, images from all of this using the PhysioU Master Cheat Sheet. So here is your transfers and assisted devices. Everything is here. So let me see. I think that actually is here's my final thoughts for you. The way that I envision and the way that I use it is that the students do their own discovery. So here's their little clinical pattern recognition worksheet for Cardiopulm. They are going to work their way through the different conditions and pre-expose themselves. Think about what that means. They're going to see techniques that you're going to talk about. They're going to see patients and begin to have a picture of what that patient sounds like. Then you will do a preview, meaning their lab handout. Guys, for this week's lab, I want you to go through the lab, click on the videos, and watch it once. If you have the equipment, try it out on somebody, because we're going to talk about it to get together. In class, it would be useful. I mean, the whole point we built for building all of these patterns into the app is so the clinician, the faculty specialist, can talk through the entire exam, talk through the interventions, and connect all the dots. So I advise that it's very useful to play through the app and allow them to see into your mind, and then you kind of add all the nice little details. You kind of make the story complete. The students will then practice. You can then finally get to simulations and case studies. And what I mean by simulations and case studies, you've seen the case studies. I think that helps to pull a lot of the pieces together. But we are also beginning to build simulations that are like choose your own adventure games. We have built 50 of them for orthopedics. We are now in the process of also building Cardiopulm simulations and also neuro and pediatric simulations, meaning they will be able to see patients, read about them, make decisions about findings, objective findings, make determinations about whether they should get them out of bed. All of these simulations we are building. Of course, that takes a tremendous amount of time. I don't think the Cardiopulm sims will be ready for another 6 months, and we've been working on them since 2 months ago. But just as an example, many of you have maybe have already seen this, but I could just show you very quickly an example of the orthopedic sims. So the orthopedic sims look a lot like this. So the students will be able to play into a case. It's like choose your own adventure. And so the students will essentially make choices about treatments, exercises, signs and symptoms that would make them stop the exercise. All of that will become available to your students probably later part of this year. So I think that is the main things that I want to share with you. I also want you to know that all of your students have access to this all through the summer for free. There's no obligation. We just want to support faculty and students in this challenging time. The way that you do it is that, and for many of you, your colleagues have already signed your students up, but at PhysioU.com/coronavirus, there's a form for you to fill out. This form will allow us to send you the codes you need, so the students can now click on any of those links, play through all of the apps, and start learning with it. So here we're essentially saying, hey, how many licenses do you need for your classroom? Faculty don't need this. If you don't have full faculty access yet, you can just email us here, faculty complimentary access. You have different access compared to the students. What does this normally cost? We are very sensitive to the debt burden that the students have. And so the students, typically these apps are $90 a year. For students, so after August 15, if this is something that you still want to utilize, it is as cheap as $54 a year, or for most PT programs, they're buying the 3 years. So they get 4 years for the price of 3, because we think it's especially useful in their first year of clinic to have all of this content with them. It's the price of one textbook. And they have, and all of these apps, all of these simulations continue to populate into the app for them. I mean, we are right on the cusp. I think many of you have received the email. We are right on the cusp of releasing our modalities app, which didn't exist a month ago. Because we heard the need from all the faculty, we started filming and building the modalities app, because how do you teach modalities without the equipment? So yesterday, myself, Dr. Linda De Silva out of Kansas, and the app building team got together, and we were vetting the app, going through each parts of the apps and the simulations to begin to show, to begin to test what are these, how are these apps actually working? Is all the content vetted? And so one of the things I can show you So this is the software that we use to build a lot of these simulations. So let me give you a quick example. For example, ionophoresis, let's say. You will be able to see now the students playing through these simulations on their own, looking at the setup, a review of the contraindications and precautions, learning about the different components, so they'll be able to hover over different parts of it. So here are the electrodes. We are actually going through all of this right now and making changes, checking the skin. There were a couple errors over there that we were looking at just now. And then as you move forward, there are videos of how to perform the entire procedure. And then case studies. So if I take you to the end here, and there are case studies. So the patient comes in with very irritable tennis elbow. Let's go through your contraindications and precautions. Let's make some decisions about patient setup. Let's talk about what kind of, if you have 20 minutes for the treatment, what kind of, how many milliamp minutes, and then what's the amplitude versus the kind of dosage. So you can see that we are trying very hard to make interactions that would help the students learn. So now please turn up your, whoops, let me do this. The students can now learn to turn up the device. Imagine what this means for them to be exposed to using these devices. So I'm just giving you a little glimpse of what we are building and how we envision the future of PT education. And this is just a little glimpse of some of the simulations we're building for the modalities app. For the modalities app, we've already finished NMES, ultrasound, ionophoresis, IFC. I mean, the bulk of it we've already finished. We are now just vetting it, making sure that it's everything is right. So I think that's all I have. I'm happy to take comments or questions. I always try to save a few minutes at the end for comments and questions. Any questions or comments? And feel free to unmute yourself, actually, if you have comments that I can help with.
Clarify, Michael, the 4 years, that includes updates on all the apps, not
That's
just
right.
Cardiopulm.
No, it's everything.
Yeah, and I comment on the chat that I don't know of any publisher that will send the student the new edition of a textbook if they bought it.
Right.
Like you're doing with this stuff. And so it's all the apps. And the last thing is that it's great that the students can take this with them to the clinic.
It's in their pocket all the time.
Yeah. I remember the old the PDR, the pharmacopoeia. The physicians always had stuff in their white coat, they pull
Right.
out. But no longer. They go to their app, and so you can do this. So
Right.
yeah, so 4 years for the PT, 3 years PTA, and go from there. So
Right.
I think that's all. Then some comments at the end.
Yep.
So
Any other comments or questions from the colleagues?
Mike, explain how you will work with the school bookstores and the various things for the students.
Yes. So
To tap into their financial aid, maybe.
many times the universities will just say, hey, we need this. We're happy to pay for it. It is very affordable. You just reach out to us at PhysioU. You can go to care@physiou.com again, and we can send an invoice either to the bookstore or to your department. And once the invoice is paid, the students have the codes sent to them, or we'll send you codes to distribute to all your students. And now, because it's built into either a course fee or it is now available in the bookstore, the students can utilize their financial aid. So many of the programs are actually just purchasing this for their students up front, or you can direct the students to PhysioU.com under student, and they can purchase what they want. If they're like, you know what, I just want to use it for this year, it's $54. Great. It's less than a ice mocha from Starbucks every month. So there's a lot of different options that we can use. But for now, remember that all of this is free. You don't even have to think about, should we ask the students to get this? They don't need to. You can already use it. You can try it out. And if it's useful to you, I think we have tried very hard to make it very affordable for the students. And I guess in closing, I would say that remember that there are a lot of free resources for the cardiopulmonary instructors available to you. Under Educator, your worksheet is here. This is where you're going to get all of your worksheets that the students can use. These are built for you. And your PhysioU Master Cheat Sheet for all of your videos are all here available for you to augment your lab handouts and your lectures.
Dr. Wong, when
Yes.
is the Modalities app going to be ready, do you think?
Yep, Modalities app. We played with it yesterday. I can show you here. It is, I'm hoping, a week away.
Wow.
It is a week away. So we submitted it to the programmers last week. This week, it is now on our development platform. So you can see it right here. You won't see it on your version yet because we are going through every single video. And so now you can click on mechanical traction. Here's cervical traction. The purpose. Contraindications and precautions. Setup. High-speed video or narrated video. You could either spend 3 minutes of your life watching me talk about it, or you could skip that, watch it in high speed, and narrate it yourself, or the students can flip through the gallery.
We can't see your screen.
Oh,
Yeah,
hang on one second. This is worth sharing the screen for. I'm so excited about this app. So what you'll see, this is our development platform. So you will not see this app yet because we're testing it. But it is ready to go. We are just going through it with a fine-tooth comb. So here you can see all of the different... I mean, I remember I hated teaching traction. There was just so many things to remember. Well, you don't have to do that anymore because you have a video of me doing it.
Preparation for lumbar traction.
Or you could save 7 minutes of your life, watch it in high speed, narrate it yourself, or skip to the images. We're going to make these images a little bit bigger, but you can see how quickly the students can learn. So we give them multiple ways to access the information. And of course we have contraindications and precautions, the purpose of this modality, the setup, steps for setup, patient education. We're working on a new patient education right now. It will have, here's why this is what this device does. This is what it's for. Here is what you should feel. These are some things that you should watch out for at home. So you can then email this to the patients after they do go through the modality or the physical agent. And we have case studies for you. So every case will have case studies that you can then utilize, and here are your little answers. What are some contraindications? This is now done for all the common modalities. Neuromuscular electrical stim for shoulder abduction, for thumb abduction, for wrist extension, for quads. Biofeedback, cold compression, diathermy, laser, all of it's here. So I'm excited. This one's going to be fun. And the simulations that I showed you will go in conjunction with this. So the students will have the app to play with. The students will have the apps to play with and learn with. But what they do on the weekend is they go back and they choose a sim. So you tell them, hey, we just finished ultrasound week. You need to go and play your ultrasound simulation, because the way I see it is you're hitting their brain another way. You're forcing them to deal with the content and make some decisions. And this is all stuff that PhysioU is building, because these are all the problems that I had as an educator that I could not solve. And so we are trying to solve that with your support as faculty. And also, I would say that we are always open to making changes. I'm constantly in contact with really amazing professors who will reach out and say, hey, this video, something's missing here, or your sound's missing. You can imagine there's so much content that we are building. It's hard to actually make everything perfect, but that is exactly why we are building it in a web-based platform. Yesterday I went in and made corrections, and then we can just publish it into the cloud. Everything is fixed. You never worry about typos forever or things being mislabeled. Everything is fixable and adjustable, and we are constantly updating the apps, and that is what the subscription from the students is supporting. Guys, thank you so much for taking the time. This video we will send to all of you, and it will be also posted on our YouTube PhysioU channel. And I hope that you are all staying safe, staying sane, and we are happy to support you. Anything that you can, when you are playing through these apps, feel free to reach out if there are things that we can do to make this better. So take care, everybody, and please stay in touch. Feel free to reach out to me anytime at mike@physiou.com. Great to see you, Sam. Take care, Karen. Bye-bye, everyone. Have a good weekend. Or we're not even in the weekend. What day is it? Anyway, who knows? Take care, everybody.